I'm a registered nurse with a bachelor's degree. I work for two different agencies. One is a home health agency that provides home health aides and homemakers for people maintaining their independence at home. And the other is an organization that has a contract with the federal government to care for injured mine workers. I was originally an art school dropout in my late teens and early 20s, and I decided to pursue a career in massage therapy and also as a yoga instructor. And at a certain point, I realized that I wanted to work more within the system to bring more of a holistic viewpoint to the medical system at large. So I pursued a degree in nursing in the mid to late 1990s, and then pursued a very varied career, as you mentioned, through now. So it's been the last 14 years that I've been doing a large variety of different types of nursing. Well, it's basically 24-hour home care for gentlemen who've worked in the mines, and a lot of these gentlemen worked without proper protection from the uranium that they were exposed to during their mining careers. So a lot of it has to do with respiratory therapy, respiratory assessment, and basically helping to keep them comfortable and independent at home. In my previous positions, I was living in Western Massachusetts. So I worked for a care management program, and my job was to care manage somewhere between 50 and 80 clients with chronic disease, and about 25% of those had HIV and AIDS, and a percentage of those had dual diagnosis of HIV and hepatitis C, often from intravenous drug use. So it was very complicated care management because these clients were living at home generally. Sometimes they were in facilities for periods of time, and they really needed a great deal of very intensive work around recovery, around management of their HIV and hepatitis C symptoms, and also treatment when we can actually get them into treatment. It's a fairly low-key job because I'm working in his home, and I basically spend my day with him. I do assessments every 2 hours, respiratory assessments. We spend time together. We play with Play-Doh. We watch TV. He likes to watch old westerns because he was sort of a cowboy in his younger age. I try to engage him in drawing. I play guitar for him. And then I do my regular assessments every 4 hours. And then I cook for him and clean for him and spend time together. And I also help toilet him and shower him and do personal care. So we do a large range of activities during my 12-hour shifts in his home. Working in an urban environment versus a rural environment, there are some fundamental differences. I worked in a small to medium-sized city in Western Massachusetts, Springfield, and it was kind of an intense place. And these days, I think everyone agrees that you can find poverty or extreme poverty or crime even in rural areas or urban areas. But my experience in the urban area was fairly intense. I think there are different energies, there's different lifestyles in an urban area versus a rural area, and the nursing is somewhat the same. You're seeing the same situations, you're seeing the same disease processes, but people's lifestyles and sometimes I think their outlook on life can be somewhat different based on the environment where they live. It takes a certain amount of autonomy, independence, and a confidence that you can walk into any situation and remain calm, maintain your equanimity, and be able to deal with whatever's in front of you. So as a home health nurse, I've walked into situations where a client is acutely ill and I've needed to make what I considered a life or death decision based on whether I sent them to the hospital or I felt that they could be cared for at home if I couldn't reach their physician. I've walked into situations where, especially in the city, where a home was an active shooting gallery and there were people using IV drugs, and I had to deal with a situation that felt dangerous or uncomfortable. There's all sorts of situations you have to face. You need to be confident. You need to be self-assured. You also need to have an understanding that when you go into a client's home or a patient's home, it's their castle, and you're going into their environment. And even though you're there to direct their care, to advise them, or possibly sometimes to tell them what to do or what they should do, it's really it's their call and it's their place. And when you walk in there, you're a guest. And I think it's an important thing to remember when you're working in home health care. It's a very crucial aspect of being able to deliver effective care and do it compassionately, and also do it with the understanding that you're walking into someone's life. Nurses face many challenges in the field today. I would say one is public perception of what nurses do. I think the media, especially Hollywood and television, portray nurses in ways that may not be necessarily realistic. And I think to a large extent, part of our job is to show that nursing is a scientifically based practice, that it's not necessarily just quote unquote the art of compassion. It's actually based on science, it's based on research, and it's based on years, on decades of really hard work by many intellectual and incredibly intelligent nurses who have moved the profession forward. Another thing I think that nurses face is, as healthcare reimbursement rates drop, as healthcare is squeezed, a lot of nurses are forced into situations where they need to provide mandatory overtime, where they're caring for more patients during the same amount of time that they used to care for fewer patients. Care is sometimes compromised, and nurses are put in positions where they can't necessarily deliver the kind of care that they were taught to perform, and the kind of care that in their heart they really want to give to their clients. In the area where I practice, I think we're being affected, or will be affected to a greater extent over the next 10 to 20 years as the baby boomers begin to retire. I think home care especially is going to see a huge boom in the next decade as baby boomers age, as they have, or some of them have, the financial wherewithal to receive their care at home. And I think as technological advances continue, we'll see more advanced care happening in the home rather than in the hospital because it's more cost effective. I think nurses in home care will continue to be very independent and autonomous. I think the demand for home care nurses will continue to grow. I also think that nurses will continue to apply nursing research and best practices not only in the hospital and in the more technological areas of nursing, but also in the home. I think there are basic questions potential nurses can ask themselves. One is, do they really want to be nurses? Two is, do they really understand what nurses do, or do they also have an image of nursing that's been influenced by the media, and do they really understand what the practice of nursing involves? I think students who are entering the field need to be realistic about the profession. They need to be realistic about how much they can earn, about what I mentioned before in terms of the public's perception of what nurses actually do. And they also need to be aware that there are certain specialties in nursing that are somewhat difficult to get into, to get your foot in the door if you're really interested in a particular area. But at the same time, if someone has the drive, if they have the interest, if they have a real passion for what they want to do, if they have a passion for nursing itself or a particular aspect of nursing, I think there are always opportunities for the people who really want to put themselves forward and really find their way.